implementing this.
Well, you are also going to be chairing, once again, the Committee on Education. And before we get to Speaker Terlahi, she's also in the Zoom room. We do have weekly progress reports from the Superintendent of Education, Jon Fernandez. If we could bring him in now, because I know he's also got a lot of other things to do today. But Jon, thanks for coming on. Sorry about the little mix-up earlier. And I guess just real quickly, if you could give us the progress report for GDOE.
Well, first of all, I want to wish everyone a happy new year and congratulations to our speaker. And I say welcome back to our chairwoman of our Committee on Education. I have to be honest, and we were wondering, well, will she want to keep education, because it's such a, it's such a tough task, as she knows already, having served as the chair. And then this year it's not going to get any easier. So just wanted to welcome them and Happy New Year, as well as let everybody know that we do have the committee is going to be hosting an informational session also next week on Tuesday at 3 p.m. Virtually, but the legislature will also be able to help get the message out to our community about what the plans are for school reopening. So we want to thank them for helping to facilitate that communication. And so I think that other than that, though, there's a lot of work that's going on, and as I know both our senators understand, there's just a lot of feelings on all sides of the issue about community health, reopening schools, and all the concerns, anxieties, and risks that are involved. And so we've taken a lot of time over the last few months to really think hard about strategies. And also pay very close attention to the public health situation. And I'm very glad to say, in our monitoring of the CAR score and looking at our own framework, that things look really good right now. But obviously we're waiting to see, that the 14 days after Christmas, after New Year's, we want to make sure that those numbers don't change, because otherwise, we've let the governor know that if those numbers change, we just really have to be really have to ensure that we reconsider, plans in the event that the public health situation declines or gets worse due to those two holidays. But other than that, we are planning again for the January 19th reopening date. We had a meeting yesterday with our board, but as you know, as of Monday, we had three additional board members that are new to the board, being Dr. Mary Okada, Mr. Robert Crisostomo, who also is a principal at St. Anthony's, and then Mr. Peter Atta, who was a returning board member and chair. And so we spent a lot of time not just going over the plan, but letting our new board members have an opportunity to ask questions and get up to speed, so that we're all operating on the same page. And again, our teachers and staff have reported on Monday, and now are kind of working at every school to get the necessary training on the safety procedures, the new normal that we expect back at the school sites, and also an update on the numbers of face-to-face students that we actually anticipate back at school. So all those details are being ironed out this week. We'll be out at the schools just to ensure that everybody is has the support that they need, and if any concerns are raised, and just to make sure that we're aware of those and can address them before we welcome any student back. And I know that are a lot of tutorials and videos that will be coming out shortly regarding safety on buses, safety at schools, that we'll be pushing through our channels, and hopefully with the governor's support through PBS and the governor's channels. And we ought to talk to the legislature as well. Any help we can get in just pushing those, that safety information out.
Don't forget KUAM.
Absolutely. Any help we can do we can get. Issa, our PIO, will be handling that, but I know she's been getting that together this last few days.
Mm-hmm. I wanted to bring up, because you mentioned Robert Crisostomo. We had him on last week in his capacity as the principal for St. Anthony's, and he was talking about how St. Anthony's is doing the pilot program with GHRA for rapid testing. And public health, they were on yesterday, and they were talking about how we have thousands upon thousands upon thousands of these rapid Binax test kits. So have you reached out, or have they reached out about the possibility of offering up any of these rapid COVID test kits to GDOE?
Yes, we are in active discussion to provide the Binex testing for school employees, so our educators and our staff, especially the ones who are going to be out at the school sites, and also looking at the possibility of students as well. So that's, I mean, it's still in the planning stage. So I'm, I don't get very comfortable until we have specific dates, and that we can push out to our people to be able to take advantage of the testing. But it's one way, we consider it a good, a way to screen, going into the reopening of schools, our employees and students, who, given the fact that we know vaccinations are not yet, able to be distributed to the educators and staff yet. But, we're having both conversations. So vaccination, we're pushing and trying to assist the government in their vaccination strategies. We've made Okudu High School available, and we've worked with the school community there to just do what we can to ensure that there's a place that people can go and get through the vaccination priorities, so that we can get to a point where we can get our school employees vaccinated, the ones who are interested in. And then we know there are many who are not yet comfortable with the vaccination, but that's where the testing could come in. And right now, the public health did ask whether we were interested, because they did have the available tests. We of course jumped on it and proposed, certainly we can make the dates available, and we can, ensure that our employees get the word. But we are waiting a final, sort of a final plan as to how to get that done. I guess when they first discussed it, there was some thought that DOE would be able to administer it ourselves, through our nurses, but there is going to still be a need for logistical support from public health. So we wanted to make sure that, we have a smooth operation and we have the necessary support to carry that out.
We had the LT on yesterday. He mentioned that he would bet. He's not a betting person, but he said that he would bet and almost guaranteed that the governor would be changing the P-Core status before the return of face-to-face. Have you heard when that's going to occur, or anything about what P-Core status we're going into?
Yeah, I'm absolutely not betting at all. I'm just going to go with the executive order that we know is out there and work with that within that authorization. And right now, it looks as if the governor is comfortable enough to go with a limited reopening. I mean, we still have a lot of safety requirements at the school sites. So, it's not going to be like we're able to bring everybody back at once. You still have to abide by physical distancing, the face mask, and so forth. So this will give us a starting point. And I think that's very important to just let the community know that on the 19th, that really is a starting point. It's not, it's not where we're going to end up. We do want to steadily expand the opportunity for face-to-face instruction. A lot of that's going to depend on the community health situation staying in a good position for us to stay open. And number two is going to take a lot of cooperation and collaboration at the school level between students, parents, teachers, and staff to ensure that all the safety requirements are met, and that we operate a safe school environment before we expand any further for other students to come in.
And just real quickly, all their nurses are back to GDOE?
Yes, our nurses were able to return back to GDOE on January 4th. So they are participating in the training and the preparation. Our social workers are returning on the 11th. They also have been assisting with public health, but that's really to support GDOE's opening and the fact that we're such a large agency. But the reality is we are working on an MOU with public health, because we don't want to abandon public health and our role in supporting public health as well. So what we're looking at is as we schedule the days for online learning and for face-to-face learning, when our school nurses and social workers are not required to be at the school sites, we are trying to plan opportunities to ensure that we assist with the testing, and the vaccination drives that public health is putting out there, because we also know that that'll affect our stakeholders as well. And it makes sense to just have a scheduled availability of our employees to assist with that, knowing that it'll help us in our efforts to keep schools and our community safe.
All right. Thank you so much, John. Was there anything else you wanted to get out this week?
No, absolutely. No, I will. I think next week we'll be able to have our public hearing and some of the final details about reopening that we can push out to the community. And at this point, I didn't want to take any more time from our speaker and our chairwoman from our committee. So I just want to welcome them again. Happy New Year to everybody. And, we'll be there next week, to give you all the details, answer any questions that our legislature might have, and then hopefully make sure that more members of our community are up to speed with the latest information so that they're ready to go when the 19th arrives.
All right. Thanks a lot, John.
Okay, thank you.
We'll see you next week.
See you next week.
Okay. Again, Jon Fernandez giving us a progress report. He comes on the show every week to just kind of keep parents and stakeholders informed about as they prepare to return to face-to-face instruction on the 19th of January. So thanks again, John. Back in our Zoom room, again, we have Speaker Therese Terlahi and Majority Leader Senator Talina Nelson. Thanks again, ladies. We'll go to Speaker